The Doctor Dilemma, a discussion of ethics created by me, Codi Korhammer. Before we get started, I briefly wanted to touch on why I chose this ethical dilemma in the first place. I am personally a healthcare worker, and I have been for about 2.5 years. I mainly work in long-term care and skilled nursing facilities. Just recently, my direction has changed a little bit, and I'm working in a post-acute rehabilitation center. This is all dealing with geriatrics, so that's our elderly. I've had different experiences working on behavioral units, working on like long-term units, subacute units, and so I've seen a wide variety of of the healthcare sphere, at least, like I said, in geriatrics. And I think that this is a very real question that we healthcare workers could have to face. Hopefully, I will never have to face this, but I think it's something that is very possible. So let's get into our scenario now that I've kind of hyped it up a little bit. So, you are a doctor or other healthcare worker in an overcrowded hospital during a global pandemic. There are limited ICU beds and limited medical supplies. Two patients are admitted at the same time for the same problem, and they both need to be put on a ventilator. Yet you only have one. So the one patient is a young, healthy individual with a high chance of recovery if given access to the ventilator. We'll say it's a young man around the age of 20, 21. The other is an elderly individual with multiple health complications prior to coming into the hospital. So this could be something like high cholesterol, maybe COPD, already has some health complications, with a very low chance of recovery if put on the ventilator. We'll say that this is an elderly man around the age of 75. So our goal today is to analyze the dilemma using 3 ethical theories: consequentialism, deontology, and ethics of care. And the biggest question that I want to focus on as well while we're going through all this, is whose life is worth saving? I know it's dark, but unfortunately, that is the very nature of this question. Is one life worth more than another? And like I said, I think this is a very possible scenario, especially in the wake of the COVID pandemic, where we were running out of beds and we were running out of supplies, and just so many things were going wrong. Even like today at my job, we had a disaster drill where we had to act like one part of the building was blown up, and we had to like move patients and decide whose life was worth focusing on at the time. So even though it is a hard question, it is a very real question that healthcare workers have to sort of account for. So I think it would be really interesting to take a look at this question through different lenses to see what conclusions we can come to. We're going to start with consequentialism. So consequentialism is the doctrine that the morality of an action is to be judged solely by its consequences. And something I found really interesting from our textbook was this quote: "We are responsible for the consequences of not only the actions that we perform, but also the non-actions that we fail to perform." That is from page 99. So in that sense, not only are we responsible for what we do, but we're also responsible for what we don't do. Essentially, non-action can also be negative. So some key aspects of this are, you guessed it, consequence. It focuses mainly on what happens after you make the decision. We also are going to focus on impartiality and maximization. A common form of consequentialism is utilitarianism, which we did talk about and was in our textbook. And some popular figures are Jeremy Bentham and John Stuart Mill. So let's get into applying this to our actual dilemma. So some key aspects, we're going to apply these key aspects. The first is consequence. What decision will lead to the best outcome? Well, one of these principles that we have to follow in consequentialism is that we have an obligation to continue human existence. That's on page 101 of our textbook. So, what decision can we make that will allow us to continue human existence, therefore will be a part of the best outcome? So, consequentialism would most likely lean towards the side of patient A, the young, healthy man. Why? Well, he has a higher chance of recovery in the first place, and if he does live, he has a higher chance of reproducing, therefore creating more life, and continuing on our existence. Not just his bloodline, but the entire human existence. It's almost like, you and one other person are stranded on an island type thing. So once again, consequentialism would side with that younger patient getting the ventilator. But impartiality, we have to decide, is this an objective decision? Is it based on facts? Once again, consequentialism would side with this younger patient. Why? The elderly patient already has pre-existing conditions. The pre-existing conditions would make it so that, sure, if they got on the ventilator and they sprung back to life a little bit and they did recover from at least that certain ailment, the elderly patient still has several other ailments that they're dealing with that could shorten their life already. If we give the ventilator to the young, healthy man, there is a better chance that he will recover fully and not have to deal with any of these problems later on down the road. So, once again, I believe that consequentialism would side with the younger patient on that. Maximization. Maximization is essentially an act is right if it brings about more pleasure than pain or prevents pain. So that's from page 96 of our textbook. So are we maximizing this pleasure? Well, if we give the ventilator to the younger patient, then we are maximizing his pleasure because he's going to live. But what about our other patient? How can we maximize pleasure or prevent pain? Well, as healthcare professionals, there are certainly things we can do. We can suggest palliative care, hospice care, comfort care, and anything of that sort to help negate that pain for the elderly patient. And that is a very real and plausible thing that we already do for a lot of patients. So if we give the younger patient a ventilator and we give the elderly patient comfort care, then we are still maximizing pleasure and preventing pain. So all that to say, by using all these key aspects and principles of consequentialism, we would most likely choose the younger patient if we were a consequentialist doctor. So that is how we apply consequentialism to the doctor dilemma. So next we are going to move on to deontology, which is the study of the nature of duty and obligation. So this is sort of like the opposite of consequentialism, is kind of how I like to remember it. Essentially, where consequentialism focuses on, obviously, the consequence and not the action, deontology focuses on the action and intention rather than the consequence. So some key aspects of deontology include universality, duty, and, of course, intentionality. So the common form of deontology is the Kantian deontology, because our popular figure for this ethical theory is Immanuel Kant, a very well-known name in ethics and philosophy. Let's get into how this is applied to our doctor dilemma. So, duty is a key aspect of deontology, and to me, this is very reminiscent of the Hippocratic Oath. So I specifically wanted to point this out because in our textbook it says, if you decide to act on the principle of keeping promises, then you adhere to a type of moral called deontology. That's on page 95. And while I wouldn't say that you're necessarily keeping a promise, I would say that the Hippocratic Oath is basically a promise to your patients, to yourself, to your fellow healthcare workers, that you are going to complete your job to the fullest. So many people attribute like the Hippocratic Oath to the quote, do not harm, which technically isn't in the actual Hippocratic Oath, but is very obviously a principle of it. So applying this to deontology, are you breaking the Hippocratic Oath when you make your decision? So are you creating harm by making a decision one way or the other? So while this doesn't specifically give us insight into which way a deontologist would lean, it does give us a good ground to start with, especially because we get into that universality, which also gives us even more ground to start with. So essentially, in making your decision, you have to sit back and think, could everybody everywhere adhere to this same decision that I'm about to make, the same moral, the same ethics. So if you think, no, this is just a one-time thing, like this is the only time I'll do that, well, then technically a deontologist would say, no, it has to be applied to everybody. Essentially, you can't be a hypocrite, right? So if I'm a doctor making a decision to put patient A on a ventilator, I have to be able to say that, yes, in every situation like this, you should put patient A on the ventilator, or vice versa. And then intentionality. Why did you pick one patient over the other? So, essentially, even though none of these really give us a good way as where to lean, I personally believe that the doctor would likely choose to treat the older patient first. Why? Because it kind of aligns with some things that are aligned in the some things that are said in the Hippocratic Oath. One being do no harm, two being your duty to preserve life. If you are preserving life and it's clear that the patient B, the elderly patient, has some pre-existing conditions and is clearly in more of a critical situation, then it would be that doctor's duty to start with that elderly patient. You know that the healthy patient, the younger patient, could probably last a little bit longer. You could probably do some preventative care while the elderly patient is in recovery. So, therefore, I feel like a deontologist would probably pick the elderly patient just based off of duty. Universability, I could see, we kind of already have this in healthcare where you focus on the more critically hurt patient, the patient that is, for lack of a better words, closer to death. Like in ERs, when you go to an ER waiting room, they take the people that are in more critical condition first. So if I have a broken arm and you have a gunshot wound that you're bleeding out of, they're going to take you first. Same thing. If I have a fever of 101 and you are like have your eyes rolling in the back of your head and you're about to like drop out, they're going to take you back first. So I think that this is already something that we universally do in healthcare. So it wouldn't be like a one-of-a-kind situation to treat the elderly patient first. And then lastly, intention. The Hippocratic Oath is basically kind of saying to me as well, like, as long as the doctor's intentions are pure and truthful, and obviously, like, he's not doing some crazy experimental stuff that's never been heard of before, he can't be faulted for the outcome. You can't be faulted for the outcome. So as long as your decision aligns with the duty to preserve life, then technically you're making the correct decision. A deontologist would say. As a deontologist would say. So essentially, I think that they would probably lean more towards the elderly patient. Lastly, let's touch on what is ethics of care. So, ethics of care, or care ethics, they're kind of similar, is the importance of interpersonal relationships, empathy, and responsibility in caring for others. Some key aspects of this include being culturally informed, being empathetic, and assessing the situation and all of its context, so being contextual. A common form of this is just simply modern care ethics. Care ethics is a relatively new thing anyways, so you won't really find it like going all the way back to like Aristotle or anything. And a very popular figure of this is Carol Gilligan. Unlike the past two that we've talked about, this is way newer. This is also very heavily female involved, which is really great to see different perspectives coming out of the philosophy field, essentially. So let's apply care ethics to our doctor dilemma. So let's get into applying our key aspects. I'm actually going to tackle two of these at the same time because I think that they go kind of hand in hand. So are you culturally informed? Are you considering the social importance of your decision? And context. Is there background information that can assist you with your decision making? So more often than not, as a healthcare professional, yes, you're looking at their medical diagnosis. You're seeing exactly what their conditions are, what their stability looks like, and what their possible prognosis is. Sure. But at the same time, you're dealing with who they are as a person. You are looking at their cultural background, you're looking at their values, you're looking at their religion, you're looking at all these different things to try and give them the best person centered care possible. So, when you're applying care ethics to something like the doctor dilemma, you need to be able to zoom out of that disaster situation almost and try your best to humanize these people, because at the end of the day they are people. They're not just patients, they're not just somebody walking in and out, they're not just a life that could possibly be gone in a few minutes. They are a full experience, they are a full range of emotions with families and prospects. So we need to be culturally informed as healthcare professionals, um, because that might change the decisions that we're making. At the same time, and something I wanted to sort of touch on as well, is this quote from the textbook, which says, "But a critical question that we must ask is whether these psychological differences are intrinsic or merely social constructions." So, more often than not, as healthcare workers, we are still human. We face these social biases, essentially, that it can be hard to turn off. So when I'm working and or when a doctor's at work, they often have to try their best to turn off these biases that perhaps they are unconsciously thinking about. You know, some nurses unfortunately have biases towards races or religions. Some healthcare professionals will have to deal with predators, like child predators. And like I was talking about in that Hippocratic Oath earlier, all healthcare workers essentially make the active decision and say, we are going to be unbiased in our care. So while we have to be culturally informed, we also need to make sure that we are not being judgmental of the patient at hand. So it's kind of like a double-edged sword there, but we need to be able to apply that to the doctor dilemma. So to do that, I think the best way is to have empathy for that person, which I was also kind of talking about a little bit earlier. Um, we need to remember that, and unlike contextualism or deontology, sure, the action, the consequence, everything has its implications. But at the end of the day, we're talking about life, something that is extremely precious and sacred. And sometimes it's not about all these fancy terms and everything. It's just simply about what we can do in the moment. And so, while I don't think care ethics gives us the sure answer of yes, pick this patient over the other, I think care ethics is a great reminder to all healthcare professionals and truly everybody that some of these situations are way more complicated than we could ever imagine, and this is certainly one of them. And I wanted to end on this note specifically because I think a lot of things we touched on this semester in ethics was really, really interesting, and I really enjoyed the class. But I think my problem with some of these ethical theories is that they are so black and white, and they want so badly to be the one true ethical standard when I just don't think that's possible. And something I really appreciate about the care ethics is that it wants us to look at the full scenario, the full person, the full everything, and analyze all the context and history behind it, and then make an informed decision. I think that's where things like deontology and utilitarianism sort of fall short, is that they want this universability, they want this objectiveness, and they want it to be, no, it's the consequence, no, it's the action. But I think in ethics, it's an amalgamation of everything. And so while I personally don't have a set answer as to who should we save in this doctor dilemma, I think the best course of action, based off everything that we talked about here today, is to consider the whole part. Consider the whole part and then what that part does for the next part. It's like cogs in a machine. Consider what one cog does to another and consider how those two cogs can affect the whole clock, right? And how that clock can affect how your wall looks and how your day moves forward. I know it sounds silly, but I just think that life is so intricate, and so I don't want to say that any one theory is better than another. I'm sure some people can find one more useful than the other. I personally think that they all have something to take away from, but I still will leave you with this question. Based off what we talked about today, with the consequentialists, with the deontologists, with the care ethicists, whose life is worth saving? Is there a correct answer? And if you found yourself in the same situation, what would you do? Thank you for listening. Enjoy your day.